The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. We're exploring traditional Chinese medicine this evening. Now we're going to dive into tongue diagnosis. Get your mirror ready to examine your own tongue at home if you like. With me to explain tongue diagnosis is registered traditional Chinese medicine practitioner Inga Spatari and her lovely model Maria Kravchenko. Welcome, ladies. All right, Inga, tongue diagnosis. Right? Okay, so we're going to start the exploration of tongue diagnosis by putting on a photo of the map of the tongue so people at home can understand the map of the tongue. Well, Inga is going to take us through this map of the tongue. Okay, so on the map of the tongue,
Chinese medicine conventionally divides the human body in 3 parts and calls it burners: a lower burner, middle burner, and upper burner. So as you see on your right picture, the lower burner includes the guts, kidney, urinary bladder, genital area. Middle burner includes the stomach, spleen, pancreas, and upper burner includes lung and heart. And the black line divides it exactly into a shape of a tongue.
okay.
And exactly this way, the organs are projected on our tongue. The root of the tongue, the lower part, shows the functional state of the kidney, bladder, uterus. The central part shows spleen, stomach, pancreas, and the anterior third shows the lung and heart.
The lung and heart on the
lung
tip.
and heart,
Okay.
yeah, on the
yeah,
tip.
that's great. So viewers at
yeah.
home can get a sense of what the map of the tongue looks like. Okay, so to understand tongue diagnosis, you're going to talk about the tongue body, right? The color of the tongue, the tongue shape, and then the coating on the tongue.
Exactly.
So the tongue body, a healthy tongue is pink.
A healthy tongue is pink, yeah.
But a tongue that's not healthy, or a body that's not healthy, is going to show different colors on the tongue body, correct?
Correct.
Okay, so what type of colors are we looking for?
We are looking for purple colors that would indicate blood stagnation.
Mm-hmm.
We are looking for pale colors that would indicate yang deficiency or blood deficiency. We are looking for red scarlet colors that would indicate yin deficiency and heat. Bluish purple color would indicate cold, and reddish purple stagnation from the heat.
So if somebody's tongue was purple on the sides, that would be blood stagnation on the liver.
Right, because the sides part belongs to the liver.
Side belongs to the liver.
Yes.
So in the center of the tongue, if it was really red, that would be heat in the stomach or spleen.
Right.
Is that how it works?
It is exactly like that.
Okay.
Yeah.
So you want to keep in mind the different colors when looking at the organs that are mapped out on your tongue, right? So pale is deficiency.
Pale is blood deficiency or yang deficiency.
Okay. So if the tip of your tongue was pale, that would be the heart. The energy of the heart is deficient.
Blood deficiency, heart, yang deficiency. You have to see the whole body.
The whole body of the tongue. Okay.
Yeah.
So we have lovely Maria over here, and just by the way, Maria is actually from Israel. Is that correct?
Right.
Israel, and she's studying here in Canada at the Ontario College of Traditional Chinese Medicine, studying acupuncture.
That's right.
And you hope to take acupuncture back to Israel.
I do, yeah. And Inga is my teacher, actually. Yeah.
Nice. Okay, so Inga, show us through Maria's tongue. To viewers at home, what they should look for.
So as you open your mouth, you look at your tongue. First, you want to see the color of the tongue. And Maria's tongue is slightly pale, dark pale. Thank you. That's first criteria that you're looking for the color of the tongue, right? And this color would speak about blood deficiency and a little bit of blood stagnation. Mm-hmm. Start of a blood stagnation, yeah.
Like stagnation all over in all the organs?
Right. It's a general body blood stagnation because we don't see it in a particular area. It's just the whole tongue color. Yes.
Okay. Mm-hmm. Okay. So let's talk about the tongue size or the shape.
Tongue shape, it's also a source of information, great source of information. The tongue could be swollen, big, that speaks about damp or phlegm. The shape could be narrow, that speaks about heat. It could be with teeth marks, that speaks about spleen deficiency, can be deviated, that speaks about wind, can be short, that speaks about yin deficiency.
So what
Yeah.
is the shape of Maria's tongue?
Once again, Maria's tongue.
Is it swollen?
It's, may I have a better look? It's not swollen, thank you. It's quivering and
It's what?
it's quivering, you know.
It's quivering.
Quivering,
Quivering.
yeah. A little trembling that in Chinese medicine speaks about spleen qi deficiency.
Okay.
Yeah, that's what I can say about
Do you look
the
at the papilla on top, the tiny bumps?
Yes, we do. We watch them when we inspect the coating of the tongue.
The coating of the tongue. Okay.
The coating of the tongue.
Okay, so just for folks at home, the papilla contain the taste buds.
Oh, absolutely.
Right, there's about
Yeah.
10,000 taste buds on the tongue that contain up to 100 taste cells that have little hairs on them that send messages to your brain and helps you perceive whether you're eating something that's salty, sour, sweet, or bitter. All right, let's look at the tongue coating.
Tongue coating is another source of information. Here I can say that Maria's tongue coating is thin and yellowish, thank you. That speaks about heat.
That speaks about heat.
That speaks about heat, mostly in middle burner, like I would say digestive area.
Do you have digestive issues?
Yeah, for quite a long time, yeah.
My understanding about the tongue coating is that if it's a thick coating, that reflects the degree of the depth of the internal pathogen. And if the tongue coating is thin, that reflects a prognosis.
Exactly, exactly. The healthy tongue coating should be white and thin, not thicker than you can see the color of the tongue body through it. And if it's thicker, that speaks about some pathogen factors like dampness. But if there is no coating at all, that's also bad because it speaks about yin deficiency.
Okay, and briefly, what is yin deficiency? Just briefly.
It's pretty complicated to say
Yeah.
briefly because it's such a complicated concept, but in few words, it's a moisture, it's a cooling system of our body. And if yin is deficient, there may appear like dry throat, dry mouth, night sweat, hot
Okay.
flushes, even low back pain.
And if yang is deficient?
If yang is deficient, symptoms of cold. Patient feel cold, there is digestion problem, bowel movement become loose.
Their tongue would be pale
The tongue will be pale.
if it's yang deficient. Okay.
Absolutely.
Okay. Talk about the moisture of the tongue.
Moisture of the tongue should be neither too much moist, neither dry. Maria's tongue's moisture is fine. Thank you.
All right.
If the tongue is dry, that speaks about either form of dryness, either indeficiency, not enough body fluids, either heat that is steaming and drying up the body fluids. And if the tongue is over moist, that's also bad because it speaks either about yang deficiency or about spleen that is not transforming and transporting the body fluids.
And what about the sublingual veins?
Sublingual
You're gonna
veins.
Flip it up, Maria.
Let's go.
All right, beautiful sublingual veins. Thank you. Why I say thank you. Why I say beautiful because they are healthy. We don't see much from Maria's sublingual veins. They are right the way healthy veins supposed to be. Otherwise, you can see the veins that are pretty swollen and dark purple, like serpentine. And sublingual veins speak also about the pathogen factors, and they also speak about where it is located, lower burner, middle burner, or upper burner.
So just generally, what has this information told you about Maria?
Generally, of course, the tongue diagnosis is not enough, right?
Yeah.
Like
It's one piece.
It's
one piece.
exactly. Right now, I know that there is blood deficiency, starting blood stagnation, spleen qi deficiency, and heat in middle burner, heat in spleen stomach.
Does smoking, medication, spicy food change the color of the tongue?
Absolutely, absolutely. Spicy food and medication change even the color of the body of the tongue. And drinks change the color
And
of
drinks.
the they change the color of the coating of the tongue.
So just quickly, what is the worst tongue you've seen?
Well, unfortunately, I happened to see one very sad tongue that made me feel sad. That were a few young girls that were in one town. That was during my PhD studies in China, in a small town, and they were having purple tongue and that speak about blood stagnation. But on that tongue, they also had a very dark, big spots, also black, that speaks even about more severe blood stagnation. and all of them were having gynecological disorders. And while I saw it, I asked myself, how can it be in the same area you see in one day few tongues that you don't happen to see through, I don't know, 6-7 years of my being in China? How does it happen? And then I just remembered that on the way towards this town, I smelled a funny smell, and I asked the driver what's that, and they told me it was a factory that was doing something chemical.
So you like the chemical factory to the problems in the person that was showing up on the tongue. Okay, ladies, we're going to take a quick break, and we're going to come back with pulse diagnosis, more on Health Matters. Acupuncture that elicits the sensation of de qi can improve facial muscle recovery, disability, and quality of life for patients with Bell's palsy. Journal of Chinese Medicine.